Hi, I'm Jay McCallum, and I'm here with Colleen Gest, who's another one of our physical therapists who has an interest in balance and vestibular conditions. And we're continuing with our series about falls prevention for older patients who are at risk of falling. And so I wanted to ask Colleen about a couple of things you like to do with your patients when you're concerned about falling. So what are some of the go-to things that you think are important?
Exactly. So we like to do a mix of standing still and moving balance exercises. And I like to get people into lots of different planes of movement. So rather than just your traditional standing on one leg and being super still, I like to get people moving around.
Well, show me. What do you like to do?
We'll certainly start with that one. But,
okay.
So Jay, let's go ahead and have you stand on one leg. Show me your balance there. All right. So if Jay needs a little bit of help, I'm going to have him hold on to something over here.
All right.
So hold on for balance. All right, that looks pretty good, Jay. You can keep a light hand touch on that.
Okay.
If you need to. If you want, you can let go. Let's just have you stick your leg backward.
Good.
Stick your leg forward. Now just kind of move it all around. But allow your chest to move too.
So I'll just move my whole body then.
Yeah. And you can move both forward. You can move both backward.
Both forward. Okay.
You can bend.
I can bend.
Bend.
You can bend.
I can bend. All right.
Okay.
And then also sometimes I'll tell people, just move your arms too.
I'll move my arms too? Yeah, okay. So I've got lots of things happening off of one leg.
And if you lose your balance,
Good.
Yeah, if you lose your balance, you just put a foot down. Don't be afraid to lose your balance because it's kind of important to know what your limits are and be able to recover from that.
Great.
So, that's number one.
Yeah.
Number two, I like to incorporate the vestibular system in as far as your inner ear. So let's just have you march in place.
Okay.
Look to me, and then look away from me, and then back and forth. Good. Keep going back and forth. Find something to focus on each time you turn so it's not just a blur. Good. That looks pretty good. All right, and so if that's easy enough, then we just do that with walking. So let's start way back here.
Okay.
Okay. So you're just gonna walk normally, and then look at me, and look to the other side, and me, and to the other side. Great. And yeah, Jay's taking a twist on it and going backward. So essentially, if you need a little handheld support, you just do the march in place one, and a feather light touch. Otherwise, you can progress to walking with head turns.
Great. Well, those are some wonderful ideas.
Up and down as well.
I like all the dynamic movement stuff. So great. So let us know if you have any questions about that. And certainly, falls prevention is a really big deal for all of our older patients. So if you or somebody you know is fearful of falling, then give us a call because we've got lots of things we can do. Thanks again. We'll talk to you next week.